What do you think the solutions are that the country's not thought of yet?
Yeah, I think this is actually very similar to the challenges we were having last year with regards to the rollout of testing, which really boils down to the fact that the U.S. really lacks a public health infrastructure, effectively a mechanism to deliver that last mile of care. Last year we spent a huge amount of effort and innovation to put a lot of testing capacity onto the system, but then it took a really long time for that to reach people and to be accessible at scale. And I think the same thing is happening now with vaccines. And again, it really boils down to that last mile problem, and how do you coordinate that access so that communities can be able to access the vaccinations at the right time, at the right place for people in the context of where they live. And I think that's one of the challenges that the U.S. healthcare system has had for a long time. And now is, I think, the opportunity for us to really address that at scale.
Does that involve, at what level are we talking? Are we talking state? Are we talking city, local? Are we getting as granular as hospitals, which obviously have some more pressing matters on their hands, at least depending on the community, than administering vaccines?
Yeah, it's a great question. So I think the way our system currently works is that our hospital system is actually incredibly good at dealing with acute care, and that's what really it's optimized for. What we have lacked is that kind of the public health dimension and the infrastructure to do very basic things. Like when you think about it, like administering a COVID test or a COVID vaccine is itself not a very complicated procedure. What is very difficult is doing it at massive scale in a way that really draws in a lot of the population. And that's not something that we can solve with hospitals. It's something that we can only solve by taking these services deep into the communities and integrate them into people's lives. To your question about where does that solution start, I think state governments have a very important role, and we've seen kind of many of the major states like really making very big moves, whether it's California, Massachusetts, et cetera, to take a big role there. But really it's about states taking big action to build the systems that enable the communities, because at the end of the day, you need to be able to have the access points, whether it's like schools, churches, community centers, et cetera. Those are the places where people can access, whether it's testing, vaccinations, or other healthcare services for following public health needs that we've had and that we're going to continue having. And so I think right now it's like the states kind of taking those actions, followed by enabling the communities, locally to be able to, take a very active role in the healthcare of the population.
Othman, I think it's worth noting that Color is a genomics company that made the quick pivot to focus on testing during this time of COVID. And I'm wondering what you've learned from that experience of building up this testing operation that is really distributed in different markets to where the people are. What have you learned from that in terms of what's working, what's not working, and how would you recommend that that's applied to the distribution of the vaccine? You mentioned churches. Is it pharmacies? Should there be a universal place where these vaccines are distributed?
Yeah, I think again, like from over this last year, one of the big lessons is that there's no single silver bullet, right? Like there isn't. The surface area is massive, and we're in uncharted waters in terms of needing to do things at such scale and also with such speed as we have now. To your question in terms of like how prior kind of experience and lessons have been learned is that I think for us, like I think the biggest lesson that I feel we've learned over time is that we keep thinking that public health challenges are a science and technology problem, whereas in reality, oftentimes it's the logistics and the kind of the ergonomics of healthcare that are the biggest hurdle. It's not as much even about funding, for example. Like we speak a lot about the challenges of funding public health, which is a real challenge, but oftentimes the gaps in access are literally because people in underprivileged communities or farm workers, et cetera, if they have to travel miles to be able to get access to basic service, they're not going to be able to do it. And so really for us, the biggest lesson in doing kind of these very big public health programs before in the genetics context and now translating them into around the COVID crisis is that the key is to use software and technology to get to people in their lives. And because at the end of the day, you're not doing, if you needed to do, big surgery on people, you'd have to bring them into a hospital. On the flip side, if it's for basic services, whether it's a test or a basic vaccine or preventative care, we can use software and technology to take that into people's homes, into their workplaces and the schools. And I think that is the big opportunity of modern public health. And so I think what's happening right now is that the COVID crisis is forcing us to build this infrastructure in many ways, kind of similar to how we built the highway system, in wartime to transport, troops and across the country, but then that served us for decades later. I think it's exactly the same thing that is happening right now, but through technology for healthcare needs.
Shepard Smith here. Thanks for watching CNBC on YouTube.